In January, the US government shut off the financial tap on several of its international programs. A move that shocked Kenya's public healthcare system, particularly its HIV response.
Almost 40,000 young people were affected.
So they could come to the places they are used to and only get padlocks.
Caught up in this confusion are the more than 1.3 million people living with HIV in the country.
41% of the new HIV infections that we have witnessed are among children and adolescents that I've told you, aged between 15 and 24.
And even as the Ministry of Health pushes for the integration of HIV services into general public hospital services, for many living with the virus, the sudden transition casts a dark shadow over their future.
It's like it was a crime being positive all through.
Ukienda na jirani yako ameenda kuchukua dawa fulani na amesikia fununu dawa fulani zinachukuliwa mahali fulani, alafu akuja kupata hapo. Kwa sasa tutabaki aje?
By 2030, the world had envisioned that it would have put an end to the HIV/AIDS epidemic. But with 5 years shy of that deadline, another spanner has been thrown into the works. And this comes when the US government announced that it would be cutting back on funding. The US is one of the biggest funders of the HIV/AIDS response, and Africa bears the biggest burden of this epidemic. And with countries like Kenya seeing emerging trends with rises in infections, especially among the young population, it is time for a change of tact and hopefully achieve that deadline in time. Situated more than 300 kilometers from Nairobi, Homa Bay's picturesque shoreline dazzles the eyes. Across the vast waters of Lake Victoria, islands rise from the depths, while on the shores, boats that have traveled the length and breadth of the lake lie docked as fisherfolk haggle over the freshest catch of the day. Around Homa Bay town, signages like this one tell the story of the once insurmountable weight that HIV placed on the public healthcare system here. We have come to Homa Bay County because statistically, previously, this was one of the counties with the highest rates of HIV infection in the country. Now, in the wake of funding cuts, especially from the US government, this county that is heavily reliant on donor funding, especially on its HIV programs, is reeling from those effects. And so we would like to see what the county has been doing and more specifically how the young people living positively are grappling with these changes. It's a weekend, and this means that the Chronic Care Center at the Homa Bay Teaching and Referral Hospital is buzzing. This is the day set aside for young people living with HIV to come in for checkups and to interact with one another. It has been 9 months since the United States Agency for International Development stopped supporting HIV programs in the country. And this hospital has been trying to cope with the changes. It's here that we meet Patience, not her real name, as she comes in for the routine checkup. Most of the people who visit this section of the hospital are young, and many, like Patience, were born with the virus.
In 2011, sure, that's when I was mature enough to know what was going on, and that is when the doctors told me what was actually going on, where I was taking the drugs. But all through, I was taking the drugs since 2004. So when I was told that I'm taking the drugs because I'm HIV positive, it didn't really hit me that much because I didn't even see if it was such an obstacle or anything. I was just okay.
However, navigating life as an adolescent living with HIV proved difficult for Patience while she was in high school.
The stigma started in 2012 when I joined Form 1. It was a mixed school. My mom thought it would be safe for me there because I was going to school and then coming back home. So she thought that it won't affect me since I would come back home and take my drugs until somebody disclosed to the whole school about my status, without my consent, that is. So everybody just told me like they knew about it, but I wasn't ready for it. So it was how they were treating me that affected me so much. So it felt like I didn't belong. Yeah, I didn't belong there. It's like it was a crime being positive all through.
It is this stigma that made patients default on her antiretroviral medication, a decision that came at a very high cost.
I was diagnosed with meningitis. Then I was put in medication. At that point, I couldn't do anything for myself. I was wearing pampers. I was being fed by a tube. My drugs were being given to me through my nose. Food was given to me through my nose. So after that, I wasn't even talking and I didn't walk for quite a while. I almost became crippled. My VL was high. Until today, it is still affecting me in the facility. Like every time the doctor sees my past medication, the way my VL used to be high, they think that I'm still doing the same things I used to do in the past, but it's not like that.
Her near-death experience made patients rethink her life. And with the support of doctors and her family, she has been on a path to recovery.
That the doctor who was taking care of me in the hospital, he later on talked to me. I think he's the one who saved me. Yeah. Later on, he talked to me, counseled me, and showed me, this is just your life. And since you are taking these drugs, it's for the rest of your life. And you see, umeacha tu kidogo na karibu kufe. Na ukikufa sahi, hao wenye wanakuongelea wakufi ni wewe ndio unakufa na wewe ndio maisha yako inakatikia hapo. So from there, I came back to the clinic.
When asked if she had heard about the funding cuts and how they will affect her treatment going forward, patients acknowledged that there was a time there was a shortage of a drug that she uses, but that has since been resolved.
So Atazanavir wasn't there last year. So that is why I would come every week to pick mine. And I would pick them for only 7 days. That was what was available at then. But today, I can have the drugs for 3 months. I can take my drugs in peace for 3 months. So I don't have to come. But it was challenging. So I always just ask my mom, if they had cut them short, how are we going to do it now? Especially us who are taking it. We are facing the consequences we didn't pay for. If again it is cut out, like we don't have the drugs, I bet it will be a crisis. A lot of people will die.
We're here at the Homa Bay County Referral Hospital inside the Comprehensive Care Clinic. And this building is evidence of the donor investment that came in to support the HIV pandemic, that is now the epidemic that the country is currently facing. And we're here to speak with the health officials here to understand the impact of the funding cuts that began earlier on this year.
The US government provided a lot of support for treatment. They also provided a lot of support for diagnostics, for lab testing. They also provided support just for, technical support for operational support. We had a Mercedes version of healthcare where a lot of the programs were parallel. We've gone back to the drawing board to say, what is it that I need to provide? What service do I need to provide? And what resources do I have? And that has been our approach. The Homa Bay is actually one of the leaders in terms of integration. This is something we had started prior to even the stop work order. Of course, then the stop work order then made it an imperative.
We've tried to capacity build our healthcare workers so that if I walk to, let's say, county referral, I went to an outpatient, I would be able to be offered that service, be it going for my pills, be it going for HIV testing, from the outpatient without having to be supported by that specific clinic for HIV.
One of the biggest HIV programs that was affected here in Homa Bay is the DREAMS project that housed 40,000 girls between the ages of 15 to 24 who were considered at risk of contracting HIV. This program was being implemented in 9 other African countries, and it sought to address factors that may directly or indirectly increase the risk of these girls contracting HIV, like the lack of education, poverty, gender inequality, and sexual violence. In Kenya, The DREAMS program supported an estimated 60,000 girls and young women.
The challenge that what we are now going to face is this 40,000 girls that we are running on a DREAMS project, because it was like we put them in an enclosure and Trump akakuja tu akafungua mlango, so all the birds flown away. Since January 26th, we have seen that program being dropped and these girls being handed over to the mainstream Department of Health, because initially these programs were partner-led. But since that cut, we have been able to activate our safe spaces within the facilities so that these girls can be retained. But we have not been able to continue offering those direct physical, financial, and food reliefs that these partners were supporting us with.
And I really applaud your courage. Si kila msee atakaonekane.
More than 200 kilometers away from Homa Bay in Nakuru County, I am meeting with Shalom Njunge, a 25-year-old orphan who was born with HIV.
In that time watu wakuwa wamejua, because my mom hakuwa amefichua hiyo siri kwamba she's positive. So alikuwa bado tu pale kwa bed, watu wanamshughulikia sema ugonjwa. So like mimi after kuzaliwa 2003 after she died, hapo ndio ilikuja kujulikana. Utotoni pale hivyo kukunywa dawa ni ngumu. So inabidi unafinywa pia na vijiko, unapewa ina maji kidogo. Unaenda ukikochi yangu unaambiwa. So pale nikifika class 7, hapo 8 nilikuwa nimeanza kugain knowledge, hapo class 6. So nilianza kupeleka classes pole pole. Wananiambia si virus mbaya kwa sababu za kuzaliwa nayo. Ndio walisema they are two different. Kuna ile ya kuzaliwa nayo na ile ya kujitafutia. Unaona sasa, so hapo ndo nilianza kulearn. Kaanza kupeleka step by step hapo class 7, 8. Ikakuwa ni ngumu kutake in.
Like patients, Shalom explains the difficulty in growing up in a society that only perceives those living with the virus as people who are morally corrupt.
Wenyewe tukiwa boarding, people will talk you. Pia your classmates, my age mates, ile love ile kabla kushow love wanakushow yani wanaweza kuweka kando. So in high school ndio ilibidi nimejiaccept. Nikasema hata sitaki kuwekewa dawa tena na nurse. Nilikuwa naziweka kwa desk.
Shalom and other youth who have been getting care and treatment for free at the Nakuru County Teaching and Referral Hospital say they now have to pay for those services.
Hata ni juzi tu, hata mimi nikiendea zamani, sikuwa na hiyo 200 shilling. Lazima ukienda facility, lazima you give out that 200 shilling. Unaona kama saa hii job zimekuwa ni ngumu kupata, hardship, unaona kama kuna job, unapata kuna kale ka ugumu fulani. Kuna service watu walikuwa napewa kama hizi unga za uji, za keep watu strong, hata watoto. Kuna zile peanuts, kuna vitu kama hizo back then zilikuwa zina work on very well. Service ilikuwa very fast.
Kulikuwa na mafunzo mengi sana. Tulikuwa tunashikanishwa mayuth. Till hiyo time mwenye tulikuja kubreak silence ati sasa hiyo CC imehamishwa itakuja casualty. Ilituguza, hatupendi publicity kwa hii shughuli. Sasa kitu kwanza unajiuliza sasa huko kwetu tumepelekwa. So kumaanisha dawa tunakuwa tunapatiwa hadharani. So ukienda na jirani yako ameenda kuchukua dawa fulani na amesikia fununu dawa fulani zinachukuliwa mahali fulani, alafu akuja kupata hapo. Kwa sasa tutabaki aje?
Most of them are saying it's good we pay the 200 than miss the medications. Those that we are continuing to sensitize and show them the importance of continuity of medication. However, there are those few who may not afford the service charge, but we normally waive them because we can't allow people to go out of medication simply because they could not raise the 200.
More than 40,000 people who were supporting the comprehensive care clinics across the country lost their jobs. Janet, not her real name, was a mentor mother living with HIV And for the last 12 years, her work here in Nakuru County focused on preventing mother-to-child transmission of the virus. Since her services were stopped, she is concerned that the number of children being born with the virus may increase.
Wakati tulisimamishwa end of January this year, ilikuwa na mshtuko mkubwa sana. Sababu kwanza tulisikia kwamba dawa hazitakuwa, kazi zimeisha. So iliharibu mambo mengi kisaikolojia na hata ikafanya wengine ambao walikuwa wanakuja hospitali wakawacha. Kuna wale ambao bado walikuwa na watoto wadogo na kuna dawa ambayo watoto hutumia ya kuzuia maambukizi. Haikuwa inapatikana wakati huo. Ilipotea kwa kipindi fulani. So hapo katikati kuna mama ambaye aliweza kukosa na hakufuatilia like apige simu ama aulize atafanyaje, alirudi tu nyumbani. As we speak, tuliporudi last month tulipata mtoto wake ameconvert, amekuwa positive. Na ni mtoto ambaye alikuwa negative tangu akiwa mdogo, saa hii anaenda kufika miaka 2. Ameturn positive akiwa mwaka na nusu.
Janet is also worried about the future of the younger generation living with HIV, given the sudden changes in support.
Tumezoea matibabu. Dawa hizi tunakunywa kila siku na tunajua impact ya kuacha. Ukiwacha itakuwa na resistance hata kama utarudia baadaye, ama utaanza kupata magonjwa tegemezi na mwishowe ufikie kiwango cha AIDS. So tulikuwa na wasiwasi wa kupoteza maisha mengi sana, wasiwasi wa maambukizi, wasiwasi hata ya watoto ambao watakuwa mayatima. Tuli-encourage mpaka wale wajaolewa waliolewa kwa sababu walikuwa wanaogopa hali yao ya HIV. Sasa tulianza kufikiria hizi ndoa ambazo ni labda za discordant, wale ambao hawana virusi, labda mmoja ana virusi mwingine hana, itakuwaje? Hiyo ndoa itadumu?
In Nakuru, nearly a quarter of the 48,000 HIV-positive clients dropped off from the program immediately the stop work order was enforced.
After the disruption, there was a drop of about 10,000, which we could not account for at that moment. But over time, we have been able to recover them through phone calls, and now the clients have absorbed the shock, they are coming back, and therefore now we are almost the 100% of our numbers. There was no time to prepare the clients themselves, so they could come to the places they are used to and only get padlocks. And it was a shock. Actually, it was a shock to everyone, to the health system and to the clients.
We're in October now, and this means that the 90-day extension of January's stop work order has already lapsed. And what is happening right now here at the Nakuru County Teaching and Referral Hospital is that officials in the health department, alongside the donor partners, especially when it comes to HIV and AIDS, are in a crisis meeting of sorts, trying to find out a work plan that will help them adjust to the changes.
The donor gave the partner some period which we are calling bridge period. And this bridge period is for 6 months, whereby now those staff were reinstated. For us as a county to get used to what they were doing and take over. We were looking at a contingency plan within a very short time, what we can do to ensure that now even come March, even if the donor or US government says completely we can't continue supporting you, we will be able to start by our feet and continue serving our people.
After speaking with young people living with HIV in Nakuru County and also speaking with the same group of young people here in Homa Bay County, I've come to the conclusion that there's still a difference and disparity in how county governments are handling persons living with HIV, especially within this population that has been deemed as the one that is responsible for the rising HIV infections in the country. And I can say that there needs to be a balance in how the whole public healthcare system is handling the funding cuts that have affected, to a huge extent, HIV services.
Okay, infections iko most probably hapa hivi sana kwa drugs. Unaweza tumia the same needle, mshare the same needle. Siwezi uweze jua my status, just sijatoka out. Moment umetumia ile needle, hata unakuja unakuwa infected. Unakuta ile highness ndio inakudrive. So whenever you get a lady, you speak your vibe, sink in ni hivyo.
Why I feel the infection is many on our side, that those people, maybe they contracted them through sexually, yeah? They got it sexually. So now they say, since alipewa na yule mse, yeye pia anataka kupeana. So you see, that mentality is bad because she ends up killing even the innocent people who are not involved in that kind of stuff.
Tunahofia sana itafika ile time yenye dawa zilikuwa zinanunuliwa. Wakati wa mababu zetu tulikuwa tunaambiwa dawa zilikuwa zinanunuliwa, unapata chupa moja ni kitu 10,000. Ikifika that point itakuwa so hectic sana kwa society, kutakuwa sana na vifo mingi sana. Kasi hizi tumeseparate, hata huwezi jua rafiki yako ni nani, alienda wapi, anachukulia dawa wapi, tulipoteanwa. Huko ndio sasa tulikuwa tuna making friends. Kama next week Wednesday una podcast, unakuja mnajuana, mnaongea. Ilifika mpaka to a point huko sana sana watu ndio walikuwa wanapatanga diaspora.
At most, if they started school early.
The National Syndemic Diseases Control Council, the body that has been coordinating HIV response in the country, says there is a disconnect in how the HIV virus is perceived now compared with the 80s and 90s when it was a visibly debilitating disease, as well as the possibility that the rapid spread of the virus among the youth is because they are engaging in sex quite early.
There is unacceptably high levels of unprotected early sexual debut that is taking place among these young people, and it's a worrying trend for us, and therefore inevitably contributing to this high number of HIV infections. Testament to this, in the year 2024, we had 240,000 pregnancies taking place among children and young people aged between 10 and 19. 240,000. That loosely translates to around 660 pregnancies per day occurring among children between 10 and 19.
Since 2020, NSDCC has been on a campaign to end what they call the triple threat. That is, teenage pregnancies, sexual and gender-based violence among the youth. This, they believe, could be the weakest link that could derail the gains made so far, because the counties of Migori, Nairobi, Kisumu, Homa Bay, Siaya, Busia, Kakamega and Bungoma accounted for 65% of the new HIV infections among adolescents aged 10 to 19. The 2025 HIV estimates by NSDCC show that there are 1.3 million people living with HIV in the country as of 2024, with nearly 20,000 new infections recorded around the same period. Over 20,000 AIDS-related deaths were also reported. Nairobi is now the leading county with the highest number of people living with HIV at over 150,000. Kisumu follows closely with more than 110,000 people. Homa Bay is third with more than 100,000 people, followed by Migori, Siaya, Kiambu and Mombasa. Emerging data also shows that mother-to-child transmission of HIV is high in the arid and semi-arid counties of Wajir, Isiolo, Samburu, Garissa, Mandera, Baringo, Marsabit and Kilifi, where mother-to-child transmissions are above 20%, double the national average of 9.3%. At the moment, some of the HIV prevention services have been stopped, and for the key populations where HIV infections are higher than in the general population, this is also an emerging area of concern.
Key population are those people who are highly at risk of acquiring HIV. So those who are HIV negative, we give them that PrEP, and it was stopped by the US government. The other prevention area was the general population, whereby those who are at risk, also we give them that PrEP. It was also stopped and was only left for pregnant and breastfeeding women. The other area was the key population themselves, the services that we were supporting them with, the general HIV prevention services. And also that meant that they were like left exposed without much support in terms of HIV messaging, condom provision, and any other service in the package of key population.
We know that there are currently about 191,000 female sex workers in this country. We have about 61,000 men who have sex with men. We have about 26,000 people who inject drugs. And we have about 6,000 transgender people. So the prevalence among female sex workers is almost 10 times as high as the general public. The prevalence amongst men who have sex with men is almost 6 times because it's about 19%. The prevalence amongst the people who inject drugs is almost 4 times because it's about 12%. And then the prevalence again among transgender people is about 6-7 times because it's about 21-22%. So you find that if you do not have programs that are addressing, that are stopping infections amongst these key populations, because these key populations also interact with the general population. We do know that a fair number of, for example, men who have sex with men are also married with families.
And stigma is the driver of new HIV infection because people don't want to know their HIV status. Ministry of Health has availed HIV test kits, HIV services, but still around 5% of the population do not want to know their HIV status. And so Fisher Folk program, they are also, because of the work that they do, they also had a high risk of HIV transmission. But Fisher Folk programming is a prevention program. But now if a cut on prevention has been taken away, it's now calling upon us to activate our outreach programs to the beach management unit so that we support them, because we have seen the roots for HIV transmission are in the beach management units. We've also done flexi hours for adolescents and young people living with HIV so that they can continue to get care and services in these facilities during the weekends. And we're also doing what we call differentiated service delivery for these adolescents, where adolescents in schools and colleges, we give them their medication for that duration that they will be in school until they get a break is when they come back to our clinic.
Apart from integration of services, there is a push to have HIV covered in the Social Health Insurance Fund.
As a county, we work very closely with the Council of Governors, and we've been lobbying for various forms of support. So, for example, one of the areas we're interested in is SHA coverage. Right now, we don't have comprehensive care for HIV under SHA. So that is something that will bring in resources and that can support people.
NSDCC says that despite the funding cuts, the government is looking at enhancing HIV prevention, and lenacapavir, the new injectable HIV prevention drug to be taken twice annually, is targeted at nearly 40,000 people in the country, among them the key population, as well as at-risk pregnant and breastfeeding women. This new drug will be distributed to about 2 million people in Eswatini, Lesotho, Kenya, Nigeria, Uganda, Zimbabwe, Mozambique, Zambia, and South Africa, with the support from the US government and the Global Fund.
By the year 2027, we'll be having this annual, 2 doses available in Kenya at a price of less than 6,000 Kenya shillings, so that we can be able to afford, even from the commercial outlet. You can actually be able to walk in, even to our pharmacies, and be able to buy. It does not prevent you from getting the other sexually transmitted infections, which you expose yourself to when you have unprotected sex. And it also does not prevent you from getting pregnancy. It's not a contraceptive.
Ultimately, our success must be measured by the impact on the people we serve. Reducing the impact, the burden of HIV, TB, and malaria, building stronger systems for health, and delivering on the promise of health and well-being for all.
In the coming days, Kenya is expected to renegotiate her terms of engagement with the US government on how HIV programs will be funded. While this may be a sign of reprieve for Shalom, he is hoping against hope that the social cracks brought about by the funding cuts will be sealed.
Mimi mwenyewe, I'm positive. And I'm glad because I was born with it. So it's up upon me kuji-accept. And ningependa kila mtu pale nje. Ni siri yako, ni hatukatai, ni siri yako, weka youth, weka mzazi. It's up to you. Accept, give in, umekubali. Show energy, show potential. Mimi niko hapa kwa sababu enyewe nahitaji tukue strong na tuweze kufight it. I'm much confident kwa sababu I know I can touch somebody's heart. Huyu mwenye anaweza guza heart yake anaweza ongelesha mwingine hivyo and we can create a good society. One mind hivyo, one truth hivyo na tunaweza saidiana.
Bridget's Ghana, NTV.